next is about the rehabilitation of the hearing impaired. So we know that what is the function of ear? Mainly ear is for hearing. Okay, so if there is any problem in hearing, we should rehabilitate the patient. Okay, so for that the available devices are, there are some instrumental devices are there, like the hearing aids. Okay, there are hearing aids like conventional hearing aids and bone anchored hearing aids like bahas and implantable hearing aids. Okay, അതായത് vibrant sound beds like implantable hearing aids ഉണ്ട്. അപ്പോൾ conventional bone anchored and implantable hearing aids are there, and some of the implants like cochlear implants and auditory brainstem implants like ABIs. Okay, these are the implants and assistive devices for the deaf. Okay, so these are the instrumental devices for the rehabilitation, and then there is some training methods like training for speech, reading, auditory training, speech conservation. Okay, so these are the various means available for rehabilitation. Okay, so here first the conventional hearing aids. The conventional hearing aids, there are two types. These are the air conduction hearing aids and also bone conduction hearing aids are there. Here the air conduction hearing aids, mainly there are three types are there. That is one which is placed behind the ear. Okay, behind the ear hearing aid are there, and in the canal. Okay, it can be put in the canal, in the ear canal, and also completely in the canal hearing aid. Okay, so three types are there. Behind the ear it can be put, or in the canal hearing aid, or completely in the canal hearing aid. Okay, in the canal, completely in the canal hearing aid. Okay, therefore the air conduction hearing aid of three types. And what are the parts of this hearing aid എന്ന് ചോദിച്ചിട്ടുണ്ടെങ്കിൽ microphone is there, and an amplifier, and also a receiver is also there. This microphone will be picking up. Okay, in case of air conditioning hearing aid, this microphone is there. This microphone will be picking up the sound and convert into some electrical impulses. Okay, and there is an amplifier is there. Okay, amplifier will amplify the electrical impulses, and there is a receiver is also there, and this receiver will receive these electrical impulses and also and convert back to sound. Okay, so mainly these conventional hearing aids, these are the devices to amplify the sounds which are reaching the ear. Okay, so conventional hearing aids in there, they will mainly they will amplify the sounds which are reaching the ear. Okay, so it consists of three parts: a microphone that will pick up the sounds and convert into electrical impulse, an amplifier will magnify electrical impulses, and receiver will convert electrical impulses back to the sound. Okay, so main function is it will amplify the sounds. Okay, the type first is air conduction hearing aid. Okay, and bone conduction hearing aid is also there. Bone conduction hearing aid is also known as BCHA. Okay, BCHA means here this hearing aid is placed over the mastoid. Okay, here a hearing aid will be placed over the mastoid. Okay, and this is a non-invasive procedure. Bone conduction hearing aid, that is a non-invasive procedure. Okay, just remind it. I will say why I specify it. So we discussed about the types. Okay, like behind the ear we can put it, or spectacle types under, അല്ലെങ്കിൽ in the ear under, like in the canal under, and completely in the canal under. Okay, so different types we can use the hearing aids at different types. Okay, and there is another third one is also there, that is the contralateral routing of signals. What is contralateral routing of signals means, here a microphone is placed on the deaf ear. Okay, it is placed on the deaf ear, and the sound thus picked up is placed to the receiver that is placed in the better ear. Okay, so there is a microphone that is placed on the deaf ear, and also a receiver that is placed on the better ear. Okay, and it is like acting as a Bluetooth. Okay, so this is mainly useful for persons with one ear that is severely impaired. Okay, so and helps in sound localization coming from the side of the deaf ear. Okay, so this will helps in sound localization coming from the deaf ear. Okay, so that is the contralateral routing of signals. And then there are also some bone anchored hearing aids are there, and this bone anchored hearing aids, its indications are if there is any congenital deformities of the external ear. Okay, so first indication is if there is any congenital deformities of the external ear, or there is a discharging ear. Okay, continuously there is discharges coming from the ear, or following MRM. What is MRM? MRM means big mastoid cavity. Okay, big mastoid cavity. So in these conditions mainly we are putting an bone anchored hearing aid. Okay, so what is the bone anchored hearing aid is doing means, it is bypassing the external ear. Okay, here this mainly the person will be having a deformity of the external ear. So this bone anchored hearing aid will bypass the external ear and directly send signals to the inner ear. Okay, so here there are some prerequisites for using this bone anchored hearing aid. That is, here the child should be greater than 5 years ആയിരിക്കണം, and also the person should be having എന്തായിരിക്കണം, the inner ear should be working ആയിരിക്കണം in this case. Okay, so here we are bypassing the signals from external ear to the inner ear. So here the inner ear should be functioning ആയിരിക്കണം. So the sensory hearing loss should be less than or equal to 45 decibel ആയിരിക്കണം. So this should be the prerequisites, that is age should be greater than 5 years and the sensory neural hearing loss should be less than or equal to 45 decibel. Okay, and here what is the mechanism? Here the implant is passed into the bone. Okay, here we are passing this implant into the bone, and it is an invasive procedure and this will send vibrations directly into the inner ear. Okay, this will send vibrations directly into the inner ear, and implant is passed into the bone. Okay, so this is an invasive procedure, and this is bone anchored hearing aid or BAHA. Okay, so earlier we said now that BAHA, that is bone anchored hearing aids, that is BAHA, and earlier we studied that bone conduction hearing aid also, BCHA. So there's a condition why this BAHA is more advantageable than BCHA, bone conduction hearing column. Bone adhesion hearing aid is more advantage, it has more advantages because here the sound amplification is 15 decibel more. Okay, in case of bone anchored hearing aid, there is a sound amplification of 15 decibel and more, and no external discomfort is there. Okay, in case of bone conduction hearing aid, we should place that like this. Okay, like a hairband we should place, so there is external discomfort is there for BCHA. But for BAHA there is no external discomfort, but the disadvantage is it is an invasive procedure, that is a bone conduction hearing aid. So this is the picture of the bone anchored hearing aid BAHA. So we can see there is a titanium fixture is there, and this titanium fixture that is embedded in the skull bone. Okay, this titanium fixture is embedded in the skull bone, and there is a titanium abutment is there. What is this abutment doing? Abutment is exposed outside the skin. Okay, so next there is a sound processor is also there. So നമ്മൾ പറഞ്ഞു in whichever cases this BAHA is used by the people who have chronic inflammation or the infection of the ear canal. Okay, or this person is saying he cannot wear the standard like in the ear or air conduction hearing aids, he don't want that, and in case and also if the children is having like malformed or absent out ear or external ear or ear canals as in microtia or canal atresia. Okay, and also single sided deafness. Okay, so in these cases only this bone anchored hearing aids are used. Okay, so you should know the bone anchored hearing aids, its use, and also and its indications where all it should be used and its parts. Okay, and there is a process you should know, that is osseous integration. Osseous integration means here we know that we will put this titanium fixture into the it be embedded in the skull bone, and it takes around 2 to 6 months for its implantation. That is a process called osseous integration should occur for its complete in the by this process only this titanium fixture is fixed to the surrounding tissues. Okay, and it will take around 2 to 6 months after the implantation. Okay, and this BAHA will transmit the vibration to the external abutment, which further vibrates the skull and also the cochlea. Okay, so if they are asking specifically the indications of BAHA, you can write if when air conduction hearing aid cannot be used. Okay, and the person is having canal atresia അല്ലെങ്കിൽ congenital or acquired ആയിട്ടുള്ള atresia, not amenable to treatment. Okay, then chronic ear discharge is there, non amenable to treatment, and excessive feedback and discomfort from the air conduction hearing aid. Okay, so the person is not using the air conduction hearing aid, and there is canal atresia or there is acquired or congenital canal atresia is there, and chronic ear discharge is there. Okay, and also the person is having conductive hearing loss or conductive or mixed hearing loss is there. Example otosclerosis or tympanosclerosis. Okay, where the surgery is contraindicated, and also if the patient is having single sided hearing loss. Okay, so these are the indications for the bone anchored hearing aid. So next is about the implants, and here the first is a cochlear implant. So cochlear implant, that is the first artificial sense organ. So it is the first artificial sense organ. Mainly this cochlear implant will replaces the organ of corti. Okay, it will replaces the organ of corti. So what are the prerequisites for using this cochlear implants? We can't use this cochlear implants like in every cases. Okay, if we can, there is sensory sensory neural hearing loss is there, and we should confirm the SNHL. Okay, so if there is a confirmation of sensory neural hearing loss, so that is the first prerequisite, and second, you should confirm there is a defect of organ of Corte. So how will you confirm that there is a defect in the organ of Corte? Okay, so these are the so we can confirm the defect of the we can confirm the organ of Corte defects, that is by first one is by the auto acoustic emission method. Okay, OAE. So this will test the effectiveness of the outer hair cells of organ of Corte. Okay, so what is the method or the test for checking the effectiveness of outer hair cells? That is auto acoustic emission, that is OAE, auto acoustic emission. Or we can do the BERA, that is brainstem evoked response audiometry. Another brainstem evoked response audiometry, that will differentiate the cochlear versus retrocochlear defects. Okay, and also you should confirm the functionality of the cochlear nerve. Okay, so here we are putting the cochlear implant, and if the cochlear nerve is not functioning, there is no usage of using it. So you should also confirm the functionality of the cochlear nerve also. So these are the three prerequisites. First, confirm the sensory neural hearing loss, then confirm the defect of the cochlear organ of Corte, that is by the OAE, autoacoustic emission, and the brainstem evoked response audiometry. Then confirm the functionality of the cochlear nerve. So what are the indications for using this cochlear implant? Is first, there should be bilateral severe to profound sensory neural hearing loss should be there. Okay, there should be എന്ത് വേണം, bilateral ആയിട്ടുള്ള severe to profound sensory neural hearing loss should be there. Then how we will say that is severe or profound sensory hearing loss? If the hearing loss is greater than 70 decibel in all frequencies. If there is a greater than 70 decibel hearing loss in all frequencies, or greater than 90 decibel hearing loss at 2000 or and 4000 hertz, 2000 and 4000 hertz, there is a greater than 90 decibel hearing loss, then we will say there is a severe to profound sensory neural hearing loss is there, or there is no result from hearing aid trial after at least 3 months. Okay, if there is any sensory neural hearing loss or anything, first we will try for the hearing aid devices. Okay, and after using the hearing aid devices also there is no result. Okay, and you should use it for at least 3 months. Okay, so there is no result from hearing aid trial after at least 3 months, then you should skip to cochlear implants. Okay, next the person should be mentally and physically stable patient ആയിരിക്കണം. So okay, that is the third indication. And fourth one is deafness means here, okay, so deafness is of two types, that is prelingual deafness and also postlingual deafness is there. What is prelingual deafness? Prelingual deafness means here the child is born as deaf. Okay, here the child is born as deaf. So what we should do here, cochlear implant is implanted or placed between 1 year to less than 7 years. Okay, within less than 7 years you should implant a cochlear implant in this child. Okay, and because why within 7 years? Because the neural integration of the speech develops by 7 years. That's why prelingual, in case of prelingual deafness, the implant should be placed between 1 year to less than 7 years. And what is postlingual deafness means here, the patient was normal, like born, but the patient was normally born. There is a people, the people who have developed speech and then become deaf. Okay, here the patient has developed speech. Okay, he has developed speech, but after that he become deaf due to some reasons he become deaf. Okay, that is postlingual deafness. So here cochlear implant should be placed as soon as possible, or as early as possible. Cochlear implant should be placed. Okay, why? Because if it is delayed, this will lead to auditory deprivation. Auditory deprivation means here the nerve becomes dysfunctional. Okay, so here this type of deafness also you should do the cochlear implantation. Okay, and the fifth indication is Montanus aphasia. Montanus aphasia, you should put the cochlea which has only Montanus aphasia means here the cochlea has only 1.5 turns. Okay, so you should here also cochlear implant should be done. And there is another condition, that is mycal aplasia is there, and in this case cochlear implant can't be used because there is both bony and membranous labyrinth absence is there. Okay, so here the components of cochlear implants, it has an external component and also an internal component. Here the external component that has it has a speech processor and also a microphone and a transmitter coil. Okay, what happens here means here first the microphone will pick up the sound and this will send the signals or the sound to the speech processor. Okay, and what the speech processor will do, it will convert that sound to digital impulses. Okay, and send that digital impulses to the transmitter coil. Okay, transmitter coil. And what this transmitter will be doing means this transmitter will transmit this sound or this digital impulses inside. Inside means into the internal compartment. Okay, into the internal compartment that is below the skin. This is placed below the skin. Okay. Okay, so here this internal compartment that has a receiver stimulator. Okay, receiver stimulator that will receive the signals from the transmitter coil. Okay, that will receive the signals from the digital signals from the transmitter coil, and the digital signals are converted into electrical impulses. Okay, so the internal compartment receiver simulate will convert that digital signals into electrical impulses. Okay. And then these electrical impulses are sent to the this one is the internal device. Okay, here this has the electrodes into the electrodes. Okay, electrical impulses are sent to the electrodes, and this electrodes, what happens, where these electrodes are going? Okay, these electrodes are passed into the middle ear. Okay, these electrodes are passed via the mastoid into the middle ear, that is through the facial recess, and from the middle ear it is placed into the it is placed via the round window to the scala tympani, that is into the inner ear. Okay, then what happens, this will replaces the organ of Corte, and this can stimulate the cochlear nerve. Okay, so this is the external and internal components of the cochlear implants. And you should study the facial recess boundaries. Medially it is bounded by the descending component of the facial nerve, that is the vertical segment of the fallopian canal, and laterally by the chordae tympani nerve, and superiorly by the fossa insudus. Okay. There's a last term, that is the auditory brainstem implant or the hearing aids. Okay, so what are this? Auditory brainstem implant means, here what is the indication means, here there is bilateral cochlear aphasia is there. Okay, bilateral cochlear aphasia, or there is bilateral nerve aphasia is there. Here the cochlea is also gone, and also the nerve is also damaged. Okay, there is bilateral nerve aphasia or damage is there. Okay, so this is mainly seen in case of NF2, that is neurofibromatous 2 cases this is seen. So here we are using the auditory brainstem implants are nammaloda use cheyana. What the mechanism is here, this will stimulate directly the cochlear nucleus. It will stimulate cochlear nucleus directly. So that is the auditory brainstem implant. Okay, and where it is placed, it is mainly placed in the lateral recess of the fourth ventricle. So that's it.